So the primary criticism of CBT in your program is that they would say it's not effective rather than it's immoral.
Yeah. And I think they would also characterize it as like part of, the sort of like medicalized model. And
Gotcha.
like
Okay.
people really don't like the medical model, and it's all like holistic and stuff like that. Which I get that, but like I'm somewhat uncomfortable with like holism in certain things. I think it like kind of lacks boundaries and like specificity. And I think like if we're going to be doing things like billing insurance and diagnosing, then like we also can't have it both ways.
Yeah. There's a number of psychoanalysts that I follow that I really respect and enjoy who make this case of, CBT is all, part of this medical model. It's just because insurance companies want to get you in and out in 12 weeks and all this kind of stuff. And I think there's some truth to that. But I think the other side of that puzzle is most people don't want to be going to therapy multiple times a week for 5 years. A lot of people, if I can get in and out in 12 weeks, I'd prefer that, So I think CBT actually meets people's wants and needs better in some ways.
Yeah. And I think it's useful for us to remember that not everything is our problem. I think when you're dealing with mental health or when you're dealing with a person in this kind of capacity, there's so much there, there's almost nothing off limits if you don't you have to be mindful of the fact that like there's almost nothing off limits if you like approach it from like a fully holistic perspective where it could be mind, body, their relationships. Like there's